Welcome to the module Third-Hand Smoke in the Healthcare Setting, a frontline forces training presented by Superior Health Quality Alliance, or Superior Health. This learning module was developed for direct caregivers working in multiple healthcare settings who care for a variety of patients. It is also relevant for family members caring for a loved one in any healthcare setting. Direct caregivers play a very critical role in providing care to individuals in many settings of care. Why? Because direct caregivers spend a great deal of time with their patients, which helps them to know and better understand the needs of these individuals. The purpose of this course is to further your learning and build on your current knowledge about third-hand smoke and how it relates to exposure, removal, and prevention. What you know and how you use that information improves the quality and safety of the patients that you care for, as well as your own safety and the safety of fellow caregivers. This learning module is part of a series of modules exploring tobacco use and cessation that are helpful in providing best practices related to tobacco use. You are viewing the third module of the series, which provides a general overview about third-hand smoke. It is not necessary to complete the entire series of modules in one sitting. You can leave and return to any of the modules at any time. After today's session, you'll be able to define what third-hand smoke is and where it can be found, describe the risks of third-hand smoke, identify ways to remove third-hand smoke from your environment, and apply strategies to prevent third-hand smoke exposure. So we all know what first-hand smoke is. And we know that second-hand smoke is the smoke that's inhaled involuntarily from tobacco being smoked by others. But what is third-hand smoke? Third-hand smoke is the nicotine and other chemicals from cigarettes that remain on surfaces well after someone has smoked in that area. Some of the cancer-causing chemicals that can be found in third-hand smoke are arsenic, benzene, butane, cadmium, cyanide, formaldehyde, lead, nicotine, polycyclic aromatic hydrocarbons, and radioactive polonium-210. So now that we know what third-hand smoke is, where can it be found? Well, third-hand smoke is the residue from smoke that settles and clings onto surfaces, objects, fabrics, and people. This includes places like floors, walls, counters, clothing, furniture, toys, drapes, bedding, carpets, upholstery, and of course, hair and skin. Third-hand smoke can reside on surfaces for years if not properly cleaned. People are exposed to third-hand smoke and to all of the chemicals and everything that comes along with it anytime they come into contact with it. And this can be in any one of the following ways. It can be through ingestion, inhalation, or absorption. Ingestion. Nicotine and other chemicals from cigarette smoke can enter the body if you touch a surface and bring your hand to your mouth. Children can also ingest these substances by putting contaminated objects in their mouths. Inhalation. Off-gassing is a term used to describe the release of residual contaminants back into the air where they can be inhaled. This can occur while dusting, sweeping, shaking pillows, and turning on a fan or an air conditioner. Absorption. In the same way that nicotine patches deliver nicotine through the skin, nicotine and other chemicals can be left behind after smoking and can be absorbed through the skin. Because children have more delicate skin, the potential for risk of this may be greater than for adults. What are some of the risks or possible risks of third-hand smoke exposure? Well, there is mounting evidence that third-hand smoke contributes to some of the following conditions: cancer, coronary thrombosis, fatty liver disease, hyperactivity, impaired wound healing, insulin resistance, and pulmonary fibrosis. So we've talked about some of the risks of third-hand smoke exposure, but how can we remove third-hand smoke? Well, here's some of the ways. We can thoroughly wash the walls and the ceilings with detergent and hot water. We can repaint our walls with paint designed to seal or block nicotine, but only after the walls have been cleaned. Nicotine can still seep through 3 layers of paint. We can remove carpeting and padding and wash the floors thoroughly before recarpeting or reflooring. We can remove wallpaper. We can wash the walls thoroughly before repapering or painting. We can replace curtains, windows, blinds. We can clean out ventilation ducts and replace filters in our air conditioner and heating systems. The bottom line is the best way to remove third-hand smoke, aside from not having it be in our environment at all, is then to wash all surfaces thoroughly. The risks of second and third-hand smoke are serious for everyone, and they are real. But they are especially risky for folks who are older or elderly. The best solution is to ensure that any outdoor smoking areas are far, far away from any areas where non-smokers will congregate. But if not, you need to be careful to ensure that you don't smoke when non-smokers are nearby. Although the levels of harmful chemicals from third-hand smoke are lower than for second-hand smoke, the risks of such exposure is again greater for elderly people. Even if you smoke outside, well away from where any non-smokers congregate, you can still expose residents, patients, and elderly people to harmful chemicals that are found on your clothes, hair, and skin. And what is the best way to prevent third-hand smoke exposure? Well, don't allow smoking inside your car or your home. Don't allow smoking near your family or your pets. Educate your family and friends about third-hand smoke and your related concerns so that they understand the rules of the house and why you've set them. Advise caretakers of your non-smoking policy. If hiring a caretaker, be sure to include a non-smoker description in your job posting. In some states, it's actually tricky and potentially illegal to ask a potential employee if they smoke. And if you've been in a house with smokers, shower thoroughly with soap and water. And even if they weren't smoking in front of you, the same applies to pets. Also clean any toys or clothes that's been exposed to smoke with a detergent and hot water. In review, third-hand smoke is the residue left behind from being near where someone was smoking, and it can be found on any surface where smoking had occurred, including people. It can last for years. Cancer and other conditions are some of the risks to being exposed to third-hand smoke. There are many methods to reducing exposure and to removing third-hand smoke from an environment, but the one true way to prevent third-hand smoke is to not allow smoking in that environment to begin with. On this slide are a number of references regarding third-hand smoke.
It's now time to test your knowledge.